If you're sick of shoulder pain waking you up in the night or waking up in the morning with a painful shoulder, you're in the right place. I want to show you how to fix it. My name's Dr. Jared, and in this video, I'll show you the best sleeping positions for a painful shoulder and what you can do to actually minimize this pain and sleep better tonight. So, which sleep position is the best position to sleep in? Obviously, there's some debate around this, but ultimately it just comes down to the individual. So whenever I make these types of recommendations, I only have two criteria. Number one, the best sleeping position for you is the one that you find to be the most comfortable. And then number two, the best sleeping position is the one that results in the least amount of pain. So for example, if you love sleeping on your stomach, but you get shoulder pain because of it, that's probably not the best position. However, if I tell you to flip over onto your back because that's a better position for your shoulders to be in, but you don't find that at all comfortable, that might not be the best position either. So please keep that idea in mind as we go through this video. This is completely subjective. I will give you some ideas, but ultimately the decision is yours. So if we talk about shoulder pain, how can we minimize shoulder pain while we sleep? The first and most important step is we need to hold the shoulder in as neutral a position as possible. Think about it. If I walked around like this for a couple hours, or if I had my arm in this position for a couple of hours, my shoulder would probably start to hurt and be pretty sore. And yet there are those of us who fall asleep in that position and hold our arms in that position and then wonder why our shoulder hurts. And so we need to get out of these extremes in range of motion to put your shoulder in a better position so that you can sleep better through the night. What is that position exactly? Well, a neutral shoulder position isn't too far behind me or too far in front. It's also not pinned here right against my side. It's out just a little bit, and we're not rotated this way and we're not rotated this way. So if we can find positions that hold our arm in this better position right here, you're going to feel and sleep a lot better. That's my job as your physical therapist. That's my purpose with this video, is to give you some tips, some advice, some recommendations, how to hold that shoulder in a better position so that you can sleep better through the night. Okay, two quick caveats and then we'll get started. First of all, you're going to need a lot of pillows. We're going to use them for bracing and support. And whenever I film videos like this and I start bringing in a lot of pillows, people always say, oh, I could never sleep with that many pillows. To which I respond, okay, then keep sleeping with shoulder pain. Do you want to try to sleep with a couple of pillows, or do you want to keep sleeping with shoulder pain? I'm going to leave that up to you. And then the second comment that I always get from people is, well, Jared, this looks great, but I toss and turn in the night. I don't sleep in the same position. To which I respond, congratulations, you're completely normal. Nobody sleeps in the same position all night long. I understand that. But what I have learned is that if we can control how you fall asleep and the position that you at least spend the first couple of the hours of the night in, it does make a big difference overall. So try it out. What have you got to lose? Okay, now that being said, let's jump in with our first sleeping position, which is actually on your stomach, which is actually my least favorite sleeping position to be in, because there's no way to keep neutral joint position. My arms have to be up, I'm flexed, I'm internally rotated, and then I'm gonna drop a big weight on top of that and then wonder why my shoulder hurts. Also, it's not a great position for your neck or for your back, but again, I understand that there are people out there who love to sleep on their stomachs. So if that's you, and if you have shoulder pain, and if you want a tip that's going to hopefully minimize it, what I would encourage you to do is try this. You're gonna get a pillow, you're going to lie it down lengthwise on your bed. And then you can get into this position right here as I lay down on my stomach, and then I'm going to gather my pillow into kind of this triangle shape right here. So now from here, you can see that I've actually created a little more room. I'm not in this fully flexed and externally rotated position. I can actually bring my elbow down below the level of my shoulder and then keep it more in this kind of neutrally rotated position. I also like this position because I can bring my face off to the side and keep my neck in a little bit better position as well. Just overall, a much better position for your shoulder to be in if you need to sleep on your stomach. But please keep in mind, it does introduce a little more extension into your back. You might feel it in your back a little bit more, but that shoulder should feel a lot better. Try that out, hope it helps. Hey, I'm curious, what is your preferred sleep position? Leave it in a comment down below. I always love to hear from you. This next part is for those of you who sleep on your back. Here are the tips that I would give you. First of all, there may be some of you who sleep on their back with your hands up here behind your head. We're in this flexed, externally rotated position. Oftentimes there's some occlusion of blood vessels and nerves with this. You might wake up with your hands tingly. Also not the best position for your shoulder to be in. I think step one is to bring your hands from this overhead position to at least down here to your side. Now, a lot of you might sleep in this position, elbows at the side, hands either on the belly or here on the chest. Here, we're just a little too extended, and we're also in this internally rotated position. It's better for your shoulder, but I think that we can do better still. How are we going to do that? Well, of course, you grab your pillow, and what I want you to try is to lay it down on kind of this 45-degree angle. From here, you can put your elbow up onto the top of that pillow. That brings it forward into a more neutral position. But then also you can use that same pillow to brace your hand in this more upright position. We're not getting into as much internal rotation in this position. And for me, I actually find that incredibly comfortable. Keeps your shoulder in just a much better position. If you sleep on your back, you might try that out. Now, if you're a side sleeper like me, here are the tips that I would give to you. First of all, if you sleep on your painful side, so if my left shoulder were painful and that's the side that I sleep on, can you flip over to the other side? Sleeping on that shoulder puts it in a bad position and also adds pressure all night long. If you can flip over, it's a better position for your shoulder to be in. But I know that there are people who say, I've always slept on my left side, I have to fall asleep on my left side. What can you do to help me? Here's the advice that I would give to you. Again, the problem is it's in a bad position with a lot of pressure on it. So if we can improve the position and minimize the pressure, those are going to be good things for you. And so at the very least, if I'm laying here on my left side, can you roll slightly backwards? And so I'm going to push my left arm towards you. I'm going to roll my right shoulder slightly back. And what you'll find is that takes a lot of pressure off of the tip of the shoulder, puts it a little bit more towards your back on your shoulder blade. For a lot of people, they say, oh my gosh, that actually feels really good. That's a significant improvement. If you want even more than that, this is where I'm going to get maybe a little bit flatter pillow at first and put it down right here. And what that's going to do is actually support my rib cage, and you see it creates this little channel for my arm to go in. And so now my rib cage is supported. I've offloaded that shoulder, and then I can sleep right here in this position. Keep in mind that because I lifted up the rib cage here, you might have to lift your head slightly higher to keep it in a little bit better, more comfortable position. But that's actually really comfortable. That minimizes a lot of the stress and that pressure that you might experience on the tip of your shoulder. So try that out. Now, if you sleep with your bad shoulder up, so if I'm sleeping on my left side and it's in my right shoulder, this is the tip that I would give to you. The reason why that most likely hurts is because it's in this adducted position, so it's pinned to our sides, and then it's also internally rotated across my body. Some people even like support it out here like this. So in order to get out of pain, we just need to move into a slightly more neutral position. I put my pillow on the ground. So to get into that position, first of all, what we can do is abduct a little bit. So even if you just add a pillow between your side and your elbow, a lot of times that helps to keep it in a little bit better position. If you really want to take things to the next level, even grab another pillow. I told you there'd be a lot of pillows. Put it right here in front of you. Put this one right here to the side. And now, as I put my arm on top of that, look at that shoulder position. I'm not internally rotating, and I'm keeping it in this much just better posture and this much better position. So I know it's a lot of pillows, but also it's a much better position for your shoulder to be in. Try that out. Hope it helps. Hope these help your shoulder to feel better, and thank you so much for watching.